So we have looked at a few indications for pacemaker therapy. So one of which was the heart blocks. And I mentioned also sick sinus syndrome last week after damage from catheter ablation therapy. Okay. So another name for pacemaker therapy is also called cardiac resynchronization therapy, CRT. Now, there are two general types of pacemakers. So we have permanent and demand settings. We do have temporary versus permanent pacemakers. Okay, so let's look at the difference between the two. First, let's finish the settings. Now, a pacemaker can be set as demand, or it can also be set to be in override mode. When we say demand, it will only fire electrical impulses if the intrinsic rate of the patient's SA node falls below 70. You can set it below 60, but most doctors set it below 70. So if the intrinsic rate, which means the SA node firing, if it fires less than 70, then the pacemaker kicks in. So that is a demand setting. There's also a override setting, which means regardless of what the patient's SA node is doing, the pacemaker will permanently fire impulses, okay, overriding the SA node. Does that make sense? Okay, any question about the two types of settings? Okay. So I mentioned it can either be temporary or permanent. When we say permanent, the pacemaker is implanted under the skin, usually on the left upper side of the chest, and the electrodes will be passed into the heart through these vessels right here, and then it will stay inside the the patient's heart, usually in the ventricles. Okay. So we have permanent, which is by the word itself, it's permanently implanted. They're also called transvenous. Transvenous means this is a type of temporary pacemaker wherein the pacemaker is outside the body. It's handheld. However, the wires are inside the patient's body. I'll explain why someone would require a pacemaker like this shortly. And the fastest way to pace somebody is through a external pacemaker. So all defibrillator machines are also external pacemakers. Okay, they are also temporary pacemakers. So you put pads on the patient's chest, but instead of giving them electric shocks, you will turn on the pacemaker function, and then it becomes a pacemaker. So therefore, if you have a patient right now with third-degree heart block, second-degree type 2 heart block, and they need a pacemaker, you have a pacemaker ready. So the defibrillator is a pacemaker as well. We also have dedicated pacemaker devices, but not too many hospitals use those because it's an additional expense. I mean, we already have defibrillators on the floor. We usually have 3 on telemetry floor. So 1 for code, another, and then 2 for mobile, meaning if a patient goes to CAT scan or wherever, they go with a monitor, okay, which is a defibrillator. So let's review. For the temporary pacemaker, so the fastest one is the defibrillator. The second temporary pacemaker, but is going to be used for a few days or a few weeks, is called a transvenous one. In transvenous pacemakers, the pacemaker again is outside the patient's body, but there are wires inside the patient's heart. Any question? Okay, so why would someone get a transvenous type. So that the fully external is called transcutaneous, meaning you are pacing the patient through the skin, hence called transcutaneous. We know the reason why someone would have a transcutaneous, obviously for short-term use, emergency short-term use. A transvenous would be temporary. However, you can put this you can keep this in for a few days to a few weeks. Okay, transvenous. Now, why would someone have a transvenous? It will be someone who currently has an infection. Let's say they have a blood infection of some sort. Can you put in a foreign object inside this patient? No, because what will happen to that foreign object? It will get an infection and it will become a medium for bacterial growth. Understand? So for those types of patients, if that's the scenario, the patient needs a pacemaker. However, patient currently has an untreated infection. That's an active infection. We cannot put a permanent pacemaker yet. So we have to finish treating the infection. Once the patient's fully treated, no evidence of infection, then we can put in a permanent pacemaker. Make sense? Okay, so until then, they will get a transvenous because you can't use a transcutaneous for more than a few hours. Transcutaneous is not very effective. Okay, it's only effective for literally a few hours use. So it can either be left or right. Most pacemakers will be on the patient's left. And here is the electrode. So if this was a transvenous, that means the pacemaker is outside and then the wires are still inside the patient's ventricles. Okay. There are MRI safe pacemakers now, so they have no metal in them whatsoever. But patients need to understand which type they have. They're usually given a card, which they keep in their wallet. They present that. They're told to carry it everywhere, especially when they go to the airport, TSA, so that they're not subjected to big magnets like the magnetometers that check for weapons. So those are big magnets, so they can't use those because that will interfere with the pacemaker function. The batteries can last anywhere between 5 to 15 years. So that's a median of about 10 years. So typically every 10 years, the battery is replaced. They are checked twice a year, both the battery and the pacemaker function. So whichever company, there are only two major companies that sell pacemakers in the United States. They are Medtronic and St. Jude. So either one will come and interrogate the patient's pacemaker. So every cardiologist has these patients' records with them, and then they schedule them. It's the cardiologist's responsibility to track these patients. Where are they? Where do they live? So that's why these patients are always encouraged to, when you change address, let me know, okay? Because we need to keep your pacemaker maintained. Okay, it has to be checked twice a year. Now let's go to the teaching now. So what will you tell the patient to do? Oh, by the way, on a monitor, since the pacemaker is now taking over the SA node, will we see P waves?
Yes.
The pacemaker is doing the impulse generation. So will we see P waves? The pacemaker is the one firing the impulses. So will we see P waves? No P waves. Again, P waves mean what? The impulse is coming from the SA node, right? And we know the atria are contracting. So in the place of a P wave, we will see pacemaker spikes. So it will appear like this now. Okay, so these are the pacemaker spikes. So if the patient has no pacemaker, this would have been P wave. But now, because they have a pacemaker, now we see pacemaker spikes. Okay, so it's either in place of a P wave, or in some cases wherein instead of the atria which are being paced, it's now the ventricles, because it can also be biphasic, meaning biphasic means it's both the atria and the ventricles that are paced. If it's a ventricular pacemaker, then it will be a no QRSs. You'll see a P wave, but then instead of a QRS, you'll see a pacemaker spike. Make sense? Okay. So it will tell you on the monitor when you see these spikes. So it's either the SA node being replaced or the QRS. Okay, so on the record, you will say, okay, so the patient is atrial paced or ventricular paced. Make sense? Okay. Let's go to your responsibility. So here are potential complications after the insertion. Now, this means that these complications occur right after insertion and then all the way to forever. Okay, these are possible. Obviously, the infection would occur usually right after the insertion, correct? So this complication here applies to newly inserted pacemakers. This one also newly inserted, okay? As the doctor may have sliced the skin a little too deep, and then they sliced into the pleural space, okay, and then caused pneumo or a hemothorax. Bleeding also right after insertion. The rest of these are not very common, especially tamponade. We'll talk about tamponade on the next topic. Let's go now to I won't test you on table 22-2. No. Okay, so the teaching is not on a chart. It would have been good if the author put it in the chart, right? But there's no chart here. It's in a paragraph, a couple paragraphs. So this is now your teaching for the patient. Can they use household electronic appliances like microwave ovens? What does it say?
Yes, I want to say something.
Yes. Okay. So those signs that you see that say pacemaker, microwave in use, those warning are like 19th century signs. Okay. They just didn't you only see them in really old buildings, old hospitals like HHC, Bellevue. You still see them.
Yeah.
They just didn't have time to take those signs down. But that's like so 1900s. Okay. No more. Pacemakers are safe to use around microwaves, because microwave ovens are modern now, unless you have some 1960s microwave oven, which hopefully we don't have any more of those. Yes, so those microwaves definitely are harmful, but modern microwave ovens are safe to use for pacemaker patients. Here, gas powered, so because these things usually have magnets, like motors, engine motors have magnets, right? In order to function, right? Gas trimmers, for instance, welding equipment. Okay, so these things have large magnets in them. Okay, part of mechanical engineering. They should be told not to be near or operate these equipment, okay, especially welding equipment. Cell phones, so they're told to keep them 6 to 12 inches away. So I have a pacemaker here. Can I use a cell phone? Why not? Yeah, so I'll hold it here. That's 6 inches, right? Okay, so at least 6 to 12 inches, right? MRIs again, no MRIs unless their type of pacemaker is modern and it's MRI safe. Transmitter equipment, large speakers, all of these things, again, radar, these things all have big magnets. Okay, that's how these equipment work. So basically, just avoiding any large electromagnetic fields, okay, because there will be interference. It won't damage the pacemaker, but then it won't function correctly. It will interfere. Okay, the magnet will interfere with the function, and of course, the patient needs that that pacemaker. All right. So in TSA, they can do the handheld screening devices. Okay, just regularly. No, you can just swipe it, but not like put it here because it will sound. Okay, because most pacemakers are metal. So when the TSA officer, oh, what is that? It's it's a pacemakers. Don't. Let me make sure. No. Just show them the ID here, sucker. You idiot. I have a pacemaker. Okay, you can't do that. So you'll have to be manually violated.
Oh,
Okay,
is it violated?
that's what TSA officers do, right? They violate you. And you can't do anything about it, or else you'll go to jail. So you'll have to request for a manual violation. Okay? ICDs. As far as the teaching, it'll be the same. So if you go here for pacemakers teaching, it'll be the same for ICD. However, there's a few things here on what to do. First of all, who gets ICDs? The answer is here. So that's definitely a test question. So these are indications. So question will be, which are indications for implanted cardioverter defibrillator, ICD? Remember the transcutaneous pacemaker? No, sorry, transvenous pacemaker,
Yeah.
wherein the patient has an infection or something.
Yeah,
okay, so if a patient has something like that, scenario is the same. They can't have a surgically implanted ICD yet. This is the external ICD. So it's a vest. It's literally a vest. You wear this over your skin. You cannot wear a shirt and then put this over the shirt. Otherwise, it will not work. Patient will wear this 24/7. And here are the electrodes. It's already designed perfectly. So if you wear it, typically it will sense the dysrhythmia and it will fire. So what will it do? It has large battery packs here. So this will be a defibrillator, okay? An external defibrillator, which otherwise would have been internal, okay? Implanted. So this one is external. So you wear this. Not many patients comply with this. I mean, is it easy? Imagine wearing this, okay, over your skin, okay, no clothing over it, and you're told to wear this 24/7. Well, you do have a break because you can laundry this. Okay, you can put it in the laundry and then make sure you take out the battery pack. Okay, when you throw it in the laundry. I mean, it's a hassle, right? So not too many people are compliant with this thing.
You said no clothing over. No, under it.
Under.
You wear this.
Yeah. Meaning you can't put it over clothing because otherwise it won't sense the dysrhythmia. Make sense? Okay. I mean, it's canvas. Okay, so is this something comfortable you would wear? No. So most patients, I mean, they of course they take it home, but then whether or not they wear it is another story. All right, what are the two rhythms that will be defibrillated? Okay, VTach and VFib. Okay, so same thing. This is a defibrillator. So it will sense those dysrhythmias and then fire. Here's the teaching. In addition to whatever was included in the pacemaker, so this is the same thing. The precautions and teachings are the same. We do have instructions here on preventing infection and then coping. Now, imagine you have a device that can potentially give you electric shocks. How do you feel?
Scary. Anxious.
Scary, right? Anxious. Okay, so that's why here you have promote effective coping. So how would you lessen somebody's anxiety.
Patient.
Explain.
Okay, teach them how it is supposed to work. Is it really a big electric shock? I mean, something this tiny. Is it really a huge electric shock? No. Okay, so it will just it is a shock. However, it won't be like painful. I mean, it's different from a big defibrillator. That defibrillator gives you 150, 200, 360 joules. This one is small, so therefore, is it capable of firing 150 joules? No, it's not. Okay, so reassure the patient it's not really. I mean, there'll be electric shocks, but not into the degree of getting electrocuted.
Will it,
all right.
will it stop? Like if they do get defibrillated,
Mhm.
let's say like they're at work, will they feel it happening
Oh, of course, unless they're unconscious.
with the implant?
Yeah, they will feel the shock.
They'll feel
Okay.
it.
But the important thing to teach them is if it fires, that means what happened? Why did it fire?
They weren't being
The
captured.
patient experienced VTAC or VFib. So therefore, if it fires, what do they do afterwards?
For the hospital.
Call 911, okay, or go to the hospital because you experienced a VTAC or VFib. It may have been a malfunction, but do you want to take the chance? No, call 911, go. Now, as far as sexual activity, because this can trigger, because what happens to your heart rate when you're having sex? It will increase the heart rate, right? Can you possibly go into VTAC?
Yes.
Yes, so reassure also the patient again and the partner. Okay, so yeah, the partner may feel the electric shock as well because you're touching the patient. Okay, so therefore, just reassure them, yes, it's an electric shock, but it's not, again, not to the degree of an electrocution. Okay, it's not like that. Okay, it'll just deliver a shock. You feel that, of course, stop what you're doing and then call 911. Okay, you don't have the option to finish. Okay, because you might the dysrhythmia might return and then you'll die. I guess they'll die happy. What?
Yes, got once. You go 911 immediately or?
Yeah.
Multiple times.
Definitely, not. Yeah, the first time. Because again, doesn't matter whether it was a moment or not. Did you have dysrhythmia?
Yeah.
Yeah, a serious or a minor dysrhythmia? It's a serious dysrhythmia we're talking about here. So call your doctor or call 911. Some people prefer, if they feel fine, they'll call their cardiologist. And then the cardiologist will advise them the same thing anyway. Okay, call, go to the ER. Because the doctor may need to adjust the medications. Okay, because obviously the antidysrhythmics may have been causing the fatal dysrhythmia, or maybe we're not giving enough medications. Okay. Either way, the patient needs to be checked out. One thing to be taught to the family is this is a defibrillator, correct? Will it do chest compressions? No, this tiny device will only deliver electric shocks. So what should be taught to the caregiver and the family? CPR. Because yes, it will deliver electric shocks, but it won't promote circulation. Patient does need to be given chest compressions. Okay, if they go unconscious, and then no matter how many times this thing will shock them, then it's useless if there's no chest compressions. And more teaching. Okay, so I can copy and paste these. Very nice, very easy to copy and paste. Okay. Select all and apply. That's it. Any questions on dysrhythmias?